I'm Dr. Josephitis, and I want to discuss what to expect after an FUE procedure. So, you've had the procedure and you want to know, hey, when can I get back into social activities, work, those types of things? Well, let me walk you through it. So, immediately after surgery, your scalp's still going to be a little numb, red, and scabby. So, visibility-wise, what to expect? Now, on the top, you're going to have very short hair. You're going to have the newly transplanted grafts on top. They're going to be held in place by very small scabs. And the back and the sides, of course, is going to be shaved very short. You're going to see very small red dots there where the grafts have been extracted. There should be no bleeding, no oozing. It should be very clean, but very short and very red. Now, we recommend you to cover the area right away for a couple reasons, and I'll go through those with you. Now, this is the cap that you should recommend using. A simple baseball cap is really the best bet to have. It's very easy to cover the scalp, and you want to have a little bit of a protection there to protect the grafts when they're in place. Now, you want a loose-fitting, adjustable baseball cap like this. You don't want those new popular fit caps because they could be a little too tight onto the grafted area. As well, you don't want to use anything like a skull cap or a stocking cap that might touch the grafts. You want to make sure that the grafts are protected from being touched and moved, but you want them to have some air and some space there. So baseball caps are usually the best bets. Scarves and bandanas are okay if they're also loose fitting. Now, you're going to want to wear those for two reasons, as I mentioned. One of them is to protect the scalp from the elements. You want to make sure that the wind and the sun is not damaging the grafts. And also, simply, you want to protect it from onlookers. It helps make you feel a little more comfortable. So that's one other reason for wearing the cap. Now, how long will you have to wear a baseball cap? And how long is this visibility and the thing going to look strange? Well, it shouldn't take that long. As you'll see over the first few days, 3 to 5 days, the back, in the donor area, the back, those donor holes heal up very, very quickly. That redness fades. You'll notice after a few days the redness fades. Also, the hairs are going to be growing right back as well, the hairs that were trimmed short. That helps to camouflage that. Now, on the top, the hair is also short as well, and the grafts, in the beginning, as I mentioned, have scabs around them. But as you wash them on a daily basis, which we encourage you to do to keep it clean and healthy, you're going to wash those scabs off. So after the first week or so, much of the scabs are going to be gone. It's going to look very nice and very clean. As you tell patients, after the first week, the most challenging part is just having a really short haircut. People aren't used to seeing you with that short haircut. That's usually the toughest part. Which is why, if you have the time and you're able, I recommend shaving your hair shorter, not as short as the surgery, but shorter prior to surgery, just to get people comfortable with you in a shorter haircut. If you can do it, great. It's a great option. If not, you'll be fine. Another thing people are wondering about is, how about the pain after surgery? Well, in general, great news with FUE is the pain is very, very little. Most patients in general don't have much discomfort at all, actually. Now, you might have a little bit of discomfort, and that usually occurs in the evening of the first day to the second day. Remember, right after surgery, your scalp is numb, so you shouldn't feel anything. But as that wears off, you might have a little bit of aching. Typically, the ache is generally in the back, in the donor area. That's the area where you might have some discomfort. Now, for the mild type of discomfort you might have, simply using an over-the-counter acetaminophen or ibuprofen is really a great option, and we encourage you to try that first off. Now, if you are one of the very few patients that they have a little bit more pain and the ibuprofen and those things are not really helping you, we also supply in your to-go home bag a narcotic that you can use to kind of top it off and help get you to that comfortable level. Now, of course, you're going to want to be using these at home, and you're not going to want to drive or drink alcohol with these, but they do help with that regard. In addition, if you have some difficulty sleeping the first couple nights, that narcotic can also assist in giving you a little better rest. Now, activity-wise, what can you expect? Now, the first week, we really don't want you doing anything strenuous, so no real strenuous activity. Walking, those types of normal daily living is perfectly fine. But after day 7, you can begin doing aerobic activity. So you can run, jog, bike, but still no heavy lifting. Don't help your neighbor move or do any type of weightlifting, those types of things. To do those things, we want you to wait at least till the day 14. And that's really when you can get back to your normal activity level. Again, back to the gym, doing your sports, whatever other things you like doing. It's a great time to get back into that. So I hope this helped answer most of your questions about what to expect after surgery and when you can get back to your normal activity. Thank you.